Vertebral levels. Common carotid artery bifurcates into internal carotid artery, external carotid artery. Common carotid artery bifurcates into two branches at level of superior border of lamina of thyroid cartilage of larynx. Extent of larynx for an adult male C3 C6, for an adult female can go higher. For an infant while swallowing, the larynx can reach up to the level of C1 vertebra. Carotid body and carotid sinus are present at level of C3. Carotid body, chemoreceptor to detect the pH and PCO2 of blood going towards the brain. Carotid sinus, it detects the pressure of blood going towards the brain. Cricoid cartilage, lowermost cartilage of larynx. It is lying at lower border of C6 vertebra. Lower border level of C6 vertebra. Cricoid cartilage lies here. Marks the ending of larynx and pharynx. Trachea and esophagus start from this level. Trachea. Trachea has 16 to 20 C-shaped tracheal rings. Isthmus of thyroid cartilage is lying over tracheal ring. 2, 3, 4. Tracheostomy. Isthmus of thyroid gland and tracheal ring 2, 3 are cut to put in the tracheostomy tube. Esophagus. Esophagus has three parts: cervical part, thoracic part, abdominal part. Pharyngo-esophageal junction. It is present at a distance of 15 centimeters from upper incisor. It is present at level of C6 vertebra. It has narrowest lumen in the esophagus due to presence of cricopharyngeal sphincter. Most of the foreign bodies which are swallowed accidentally are lodged here. Esophageal constrictions 23 centimeters from upper incisor. At T4 level, it is due to aortic arch compressing on the esophagus 28 centimeters from upper incisor. At the T5 level, it is due to left main bronchus compressing on esophagus 40 centimeters from upper incisor. At the T10 level, it is due to esophagus compressing the right crus of diaphragm. Esophageal constrictions 23 centimeters from upper incisor. At T4 level, 28 centimeters from upper incisor. T5 level, 40 centimeters from upper incisor. T10 level. Esophagus passing through right crus of diaphragm. Important information. Most of foreign bodies are found at cricopharyngeal sphincter muscle. It is common in children and psychiatric patients. Length of esophagoscope required is 15 centimeters. Bronchoaortic constriction, as in ENT and surgery books. Esophageal constrictions due to aortic arch and left bronchus. It is present at 25 centimeters from upper incisor. At level of T11 vertebra, esophagus continues with stomach in abdomen region. In case of left arterial hypertrophy, left atria may compress on esophagus posteriorly. This can be visualized in transesophageal echocardiography. Subclavian artery, scalenus anterior muscle. Origin, cervical vertebra. Insertion, scalene tubercle of inner border of first rib. Scalenus anterior muscle divides the subclavian artery into three parts: proximal to the muzzle, first part; deep to the muzzle, second part; distal to the muzzle, third part. Third part of subclavian artery passes superior to the first rib, crosses its outer border to enter axilla. Third part of subclavian artery enters to axilla, becomes axillary artery. The tendon of scalenus anterior muscle is sandwiched between subclavian vein anteriorly, subclavian artery posteriorly. Important information. At the outer border of first rib, subclavian artery becomes axillary artery. At the outer border of first rib, axial vein becomes the subclavian vein, running on superior surface of first rib. The subclavian vein then goes towards the internal jugular vein. With it forms the brachiocephalic vein. Third part of subclavian artery block. Third part subclavian artery runs on superior surface of first rib. Therefore, third